This isn't supposed to happen in 2005 to a gay man in America who gets tested regularly for HIV. How did this happen? That I have this 1980s kind of situation of not only do you have HIV, but you have AIDS. You have an advanced, untreated HIV disease. So I had to start taking medication right away, which brought its own crises. How am I going to pay for this? My individual health policy capped prescription coverage at $1,500 a year, which was fine as long as all I needed was allergy medication in the springtime. But suddenly my medications cost more than that a month. So that launched a major crisis. How am I going to pay for this? Well, the good thing is that I'm very resourceful, and that's part of why I'm a reporter, is when I don't know something that I need to know, I know where to go to ask, where to find the experts who can advise me and give me the information that I need to write the articles that I write, to do what I need to do with fact-based, credible information. So I was able to get into a clinical trial for 96 weeks that paid for my medications. At that time it was Kaletra and Epsicon, which I took for the next almost 10 years, actually, same combination. But the other thing that was going on, the medical aspect of it, within a couple months, my viral load was undetectable, which is the optimal situation for HIV management. But the existential aspect of living with HIV, this new person, this new stage in my life, was something that I'm still grappling with. So after a few months, I asked Ben, my doctor, for a referral to a psychiatrist, because I said, Ben, I'm crying all the time, I can't sleep, and maybe I need an antidepressant. And I was very willing to do that if that's what was determined to be useful. So I went to a psychiatrist in Washington. Oh, I should also mention that I had worked for the American Psychiatric Association AIDS office in the early 90s. So I've known a lot of psychiatrists, I've known a lot of psychologists, mental health providers. I had seen therapists to work out things in my own life. So I was very comfortable with the idea of mental health. I didn't feel the stigma toward mental health that is all too common. So asking for a psychiatrist was kind of like if I needed another specialist. It's all that it meant to me. And so I went to see this psychiatrist who actually turned out to be quite wonderful. And in my intake interview, he said, you don't need medication. He said, you're depressed, but it's a situational depression. Anyone would be depressed in this situation. That your whole world, your whole sense of who you are, where you're going, where you belong, has been overturned. So it's a matter of adjusting to this new reality. And he said, in actual fact, you're quite resilient, and that this was an exciting time in your life because it gave you an opportunity to rethink many things. What do I want for myself going forward? Basically, what it was is a major confrontation with the reality of my own mortality, that I am human, that I am vulnerable, that all those years that I dodged a bullet, so to speak, wasn't because I had that genetic mutation of my CD4 cell that prevented HIV from infecting me, but that I was human, and that I had made choices, engaged in behaviors that put me at risk for HIV, and that I had contracted the virus, like many millions of other people. So the admission that I was human was also a major step forward in my personal evolution as well, because I thought, again, that I had dodged that bullet, that somehow I was protected. Maybe it was even because I was a reporter, that I was spared so that I could bear witness to this and continue to share other people's stories, what they had been living through. So that was my experience, seeing a psychiatrist for my own need to adjust to my new identity, my new place as an HIV positive gay man. But what really captured my interest and was the catalyst really for the book now 12 years later, Stonewall Strong, was the doctor's comments about my resilience. I hadn't really thought about it before that. And so he kind of brought this issue to my consciousness. And over the years following, and certainly while I was writing Stonewall Strong over the last 5 years, I reread my journals. Those were the source material for the first part of the book, which is very personal, very firsthand accounts of wanting to understand for myself how it is, what were the forces, what were the choices in my life that brought me to that moment of diagnosis. But I was more interested in knowing why it was that even with that devastating medical diagnosis, even with the confrontation of the reality of how am I going to pay for these expensive medications, I somehow had a sense that I'll pull through this, that I'll manage to get what I need, that I will survive because I'm a survivor. Well, at what point had I started thinking of myself as a survivor? And where did that come from in my own past? So in attempting to answer questions for myself personally, I set out to understand this whole concept of resilience more generally. And I started reading about it, I started writing about it. I did a story in 2013 for The Atlantic called The Power of Choosing Resilience. It was focused on gay men, and it was kind of laying the groundwork for the book. We sort of published some articles and gain a track record writing on a subject so that you can leverage that hopefully into a book contract. And that's exactly what I did. But what I found is that resilience as a concept in studying and talking about and treating and caring for gay men in particular was a really novel idea. That the focus in all the years of HIV, 37 years next month since the first AIDS cases were diagnosed, in 37 years, we are only now in the research and in the programs being funded by CDC, we're only now, in the last few years, starting to talk about resilience as a building block, as a foundation for HIV prevention, for HIV treatment and adherence. Dr. Simon Rosser at the University of Minnesota told me one time in an interview, healthy men make healthy choices, unhealthy men don't. It's really that simple. So if we can find a way to support the mental health and sense of well-being and wholeness of people at highest risk for HIV, or highest risk if they have HIV for not adhering to their treatment, then there's hope that we can make a real dent in new infections and keeping people with HIV from disease progression. The most shocking thing that I found in my reporting for Stonewall Strong was the high rate of childhood sexual abuse among gay men, but the most exciting thing that I found, that I learned, was about trauma-informed care. Dr. Eddie Machtinger at UCSF is the head of the Women's HIV Clinic, and he works with women of color and lower-income women. And he described to me the miracles that were occurring in their clinic when they used a drama program. It was called the Medea Project, where they had women who, these particular women who participated in that project were incarcerated. And what they found is that as the group of women met together and became comfortable with the group, slowly they disclosed things about themselves and their lives, and they were encouraged to tell their story in a kind of a theatrical presentation for the other women. And what they found is that as women were able to talk about their own childhood sexual abuse and other traumas that they had experienced, that they just had life-changing turnarounds in people. Women who were addicted to crack, who were now holding down a job, had an apartment, had a car, had a circle of friends. And it was really remarkable what he described. Dr. McIntyre said that when he sees new HIV infections, he looks at them as a symptom of trauma, not anything else. He says it's trauma, it's a symptom. This is, it's a traumatic experience to have an HIV diagnosis, but it's trauma that led to the behavior, the choices that put someone in the way of HIV. And I know this for myself. Addressing the trauma is, as Dr. McIntyre put it, would make doctors healers and not just treaters. And that's a really important distinction. I've been thinking and writing a lot about this whole idea of healing. And I've been doing a lot of it myself as well. And so much of it has to do with the story that we tell ourselves, the words, the language that we use to describe our health situation, to describe our experiences. So that, for example, if I tell myself that having HIV means that I'm immoral, that when gay men ask one another, are you clean? Well, obviously the opposite of that is, are you dirty? So if I thought of myself, if I internalize that and say, wow, I guess I really am dirty, I'm unworthy of love, I deserve to be marginalized. Well, that's a pretty devastating way of thinking about yourself. And I would dare say that someone who feels that way, who tells himself that that's what having HIV means, is not going to be very motivated to care for his health and to adhere to his treatment. Likewise, someone who doesn't have HIV, but who feels that, gee, I grew up poor, I'm black. I have something that society tells me means something not good. And if I believe that in my own heart, what motivation is that going to give me for protecting myself if I'm HIV negative? Or for sticking with my medication? Why would I feel hopeful about my future if that's all I have to look forward to, is more of that kind of bleakness? But if I tell myself, on the other hand, having HIV means that we live in a dangerous world. There are dangerous things out there, including microbes, and sometimes they get in our bodies. And, humans attach meaning to things. Humans attach meaning to microbes. They don't inherently have meaning in and of themselves. So that, for example, is it really realistic that having one virus means all these things about you, but having a socially acceptable virus like the cold virus has no meaning? We don't attach meaning to that other than everyone gets a cold. So it's the same thing. The language, the words that we use, the story we tell ourselves about what our trauma means, about what our experiences mean, can really make the difference between health and literally dying by not protecting ourselves, by not adhering to treatment.